Well, in today's lecture, we will discuss the gallbladder carcinoma. We will know the causes and clinical features of gallbladder carcinoma, and at the last, we will talk about the sonographic findings of gallbladder carcinoma. So, let's to know the gallbladder carcinoma. Cancer of the gallbladder walls. So, cancer of the gallbladder walls is termed as the gallbladder carcinoma. Although the gallbladder carcinoma is uncommon, but in the carcinomas of the biliary tract, the most common chances is of the gallbladder carcinoma. Now, what will the possible causes for gallbladder carcinoma? The first and most common cause is the calculus or stone. So, for gallbladder carcinoma, the most common cause is the calculus or gallstone. If there is stone in the gallbladder, that will chronically irritate the walls of the gallbladder, and that chronic irritation is the most leading cause for the gallbladder carcinoma. Nearly 80 to 90% cause of the gallbladder carcinoma is the gallstone. Second, chronic cholecystitis. Gallbladder can get two types of inflammation, which is acute and chronic. Acute is rapid in onset but for short duration, and chronic is slow in onset but for a long duration. Now, what will the clinical findings or signs and symptoms of the gallbladder carcinoma? Clinical findings of GBC. First, the patient of GB carcinoma may be completely asymptomatic. Or it may have nausea and vomiting. Third, generalized body aches, right hypochondrium or right upper quadrant pain, and also weight loss, hepatomegaly, and jaundice. The patient of the gallbladder carcinoma may be completely asymptomatic, and detection of these carcinoma occur during the routine examination. And if they may have some signs and symptoms, that will nausea and vomiting, and also the generalized body aches, pain in the right hypochondrium or right upper quadrant where the gallbladder is located, weight loss, and the hepatomegaly, enlargement of the liver from its normal range, and also the jaundice. Now, what will the sonographic findings of the gallbladder carcinoma? Sonographic findings of gallbladder carcinoma. First, mass will have irregular outlines or borders and altered echogenicity. So in sonographic findings, the mass of the carcinoma will have irregular or rough outlines or borders with altered echogenicity. It means it may appear sometimes hypoechoic and sometimes hyperechogenic. Second, mass will have mass will be more than 1 centimeter in size. So if it is malignant, it will have more than 1 centimeter size. Third, during gallbladder carcinoma, there will be focal or diffused wall thickness. Focal or diffuse wall thickness. If the part of wall where the carcinoma is attached become thick, that term is the focal wall thickness, and if the complete wall of the gallbladder becomes thick, then its term is the diffuse wall thickness. And it may sometimes become so enlarged that completely fill the gallbladder fossa and also invasive to the nearby hepatic or liver tissues.